So ERCP is an abbreviation for a very long name, which is Endoscopic Retrograde Cholangiopancreatography. I'll break that down. The E, or endoscopic, means that the procedure is done endoscopically using an endoscope similar to what we use for standard upper endoscopy and for colonoscopy, in which the procedure is performed over the back of the throat and down through the esophagus, stomach, and upper small intestine. So it's all done through the mouth. Retrograde refers to the fact that when we enter the bile duct, we're entering the bile duct from the bottom and working our way up. So that's where retrograde comes from. And cholangiopancreatography indicates, in some ways, two halves of the procedure. One is cholangio, indicating that we can image and intervene the bile duct system, and pancreatography, meaning that we can image and intervene upon the pancreatic duct system. So we generally use this procedure for a few things. In the past, if we went back several decades, there was a fair amount of use of ERCP for diagnostic purposes. We don't do very much of that anymore. Diagnostic purposes meaning that we would go down with a scope, we would put a catheter into the bile duct and or pancreatic duct, inject contrast dye, and take X-ray images. The reason we don't do it for diagnostic purposes anymore is that we have MRIs that can accomplish that with about the same accuracy. And so because MRI allows us to get the same information with less risk to the patient, without the need for sedation and without the need for instrumentation, most of the time we'll use MRI in order to obtain that diagnostic information. In addition, we have other endoscopic procedures that can obtain similar information that is simply diagnostic, and that's endoscopic ultrasound. Endoscopic ultrasound will allow us to visualize the bile duct and the pancreatic duct very well without actually touching those structures, and therefore we can get similar information with lesser risk to the patient. The time that we need ERCP is when we actually need to intervene on an abnormality within the bile duct or the pancreatic duct, and those abnormalities fall into a few general categories. One is stones. Stones can form, these are generally gallstones, gallbladder stones. The patient may still have his or her gallbladder, or the gallbladder may have been removed in the past and a stone has reformed in the bile duct. And those stones can cause blockage of the bile duct that can cause infection, cholangitis, fever, chills, yellowing of the skin or eyes, or jaundice, and of course pain. Those stones need to be removed, and they can be removed at the time of the ERCP procedure. Some patients can also form stones in the pancreatic duct, particularly if they have chronic inflammation of the pancreas from chronic pancreatitis, caused either by a genetic abnormality or by chronic use of alcohol and cigarettes. Other patients may have a narrowing of the bile duct or pancreatic duct called a stricture. This is a scarring that can occur either because of an injury to the duct or because of an inflammatory process, and that narrowing will also cause similar symptoms to those caused by stones. And those strictures will need to be evaluated, brushed to check for abnormal cells, biopsied, and we can place stents in those strictures to open them up to improve the flow of bile and to restore normality to the liver blood tests and to relieve infection. So again, those kinds of interventions are ones in which we use ERCP. And then finally, we'll commonly do ERCP for something called a bile leak. One of the most common operations done in the United States is a cholecystectomy, or removal of the gallbladder. Since the early 1990s, those surgeries have been done laparoscopically. And that's a great advantage to the patient because it's less invasive. But one of the disadvantages is that sometimes patients can develop a leak of bile from the bile tree after the gallbladder is removed. And that leakage of bile can cause a lot of irritation, pain, and infection. And so in order to ameliorate that leak, we can intervene at ERCP by placing a stent in the bile duct and encouraging the flow of bile in its natural path through the intestinal tract and away from the leak so that the leak can resolve.